most famous physical therapist on the internet.
Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So what is causing your knee pain? We're kind of doing a series of videos on this. How to know, is it patellar tendonitis or quadricep tendonitis? So we're both talking about tendonitises.
Inflammation of the tendon.
Right.
This is just one possibility of knee pain.
Yeah, so your muscles narrow down and attach to the bone through a tendon.
In this case, it's these quad muscles.
Yeah, or actually in this case, it's really attached from bone to bone.
Right. Yep. Could be here above the patella or below the patella. Yep.
Now we're using the word tendonitis, and that means inflammation of the tendon.
Yep.
But you could also have tendinopathy. Now that when the tendinopathy, the tendon is actually wore out a bit. It's actually a wearing of it. And you're going to have kind of identical symptoms, so we're just going to treat them both the same.
Right, that's pretty typical.
All right, they're both usually caused by stress or use of the tendon, like as you age and if you don't have enough muscle tone that can infect it. We also see it like they call it jumpers problem, where jumper syndrome.
It's basically an overuse with stressful activities, jumping, going up and down a lot of steps possibly.
Well, I got quadricep tendonitis from doing lunges, and I was doing one every day, and I was doing too much, and I'm like you sometimes. I just don't have a down throttle.
You always got to kind of stress, hit the limit, and see how far you can push your body. Don't do that.
So as Brad said, there's two common types of tendonitis in the knee. One is felt at the top of your kneecap, directly above. So it's right
on the borderline of that.
Right on the borderline. That's the one I got.
Right there.
The next one is actually patellar tendonitis. So you have the round or oval-shaped kneecap, depending on your well, we don't know what shape it is. But right below that, especially if the legs are relaxed, you can feel a tough tendon there.
So if you tighten it, I can distinctly feel it. You got to remember the quadriceps, four big muscles, pretty big muscles. Someone's a smaller one, but they all come down and they connect. All of them connect to the top of the kneecap, and the patella, and then the tendon below it. It's actually all part of the same unit.
Yeah.
So this one down here is very strong and it's very distinct. And, I can clearly feel it right there's the edge, and actually you can kind of see it a little bit right there, the sides of it. And then it connects up to that tibia bone right there.
Yeah, tuberosity, yep. All right, so the first thing you're going to want to do is actually just take your hands and feel. Are you tender in those spots?
Yep.
That's probably the best indicator of whether or not you have problem.
Right.
And you want to feel on the painful side and the non-painful side.
Compare and contrast.
Now, in my case, I had them both were tender, so
really?
that didn't help.
What were you doing?
Lunges.
Oh, with both legs.
Yeah.
Yeah, that's a good thing, too.
Well, I'll tell you, it lasted quite a while, too. So
like weeks?
A long time. I finally the massager took it away.
Did you quit doing lunges?
Yes.
Oh, good.
Yes, I did. All right. So you go above the kneecap, down below the kneecap. You can also have Osgood-Schlatter's disease if you have tenderness over the bony bump itself.
Yeah.
So underneath the kneecap, again, the tendon runs down and attaches to the bump. If you're like age, typically in boys it's 12 to 14, in girls it's 10 to 13. It's that growth age where they're growing so rapidly the tendon can't keep up.
Sure.
And so it's pulling on that bone unusually hard, and it's actually irritating that area.
And you can get actually a bump or a bony bump there, the growth as a result of that. The body,
because it's pulling on it so much.
The body's trying to get some calcium there to make the area stronger, and it's a problem. It's not fun.
Now, if you hop on one leg or two legs and that brings on the pain, that's a sign too of a possible tendonitis. So, which makes sense again if it's a jumping injury, like if you're a high jumper and jump off the same leg again and again. So, also sometimes if you do a quick stop on the leg, you're walking along and all of a sudden you
stop the turn direction.
And you might feel it because that's the quad is really kicking in, and so is the patellar tendon there. So, if you have increased pain with prolonged sitting, especially if your knee's kind of bent, you know.
Yeah, if you're sitting like this and put your feet underneath, it's stressing that area a little bit more. You know, and then if you straighten it out and it maybe relieves the pain, that would be a good indication.
Now, tendonitis and tendinopathy often also feel a little bit better once you warm up a little bit. So that's another sign that the pain from the tendonitis will feel better after you've got some blood flow to the area.
Right. Yep.
So, but again, big thing is palpation.
Yeah.
Feel,
and you just don't touch the skin. You got to kind of push in there.
Yeah, you got to be aggressive.
Get right along the edge of the bone, and in between the kneecap and that tibia on the bottom side. I bet you probably the vast majority will experience tenderness when you're palpating.
If you have tendonitis.
Yeah.
By the way, this video is part of a series of videos on knee pain by Bob and Brad. Go to bobandbrad.com, go to the program section, and we got a bunch of programs there: sciatica, TENS, hip pain, neck pain.
Neck will be
coming on. Yep.
And so if you look at this and it says not complete yet on the bottom, we've got 20, 30 videos on.
We have to upload one a day.
And
it takes a while.
We have a PDF printout, which takes a little time to get that in there too. But the big benefit is you can print out a review of the whole video. You can refer back to it, ad lib as you'd like to.
Right.
And there's not even a charge or even a request for email for any of this. It's completely free, and it makes it so nice. You can go to all these knee programs, pick it out from the title.
Yeah, pick out
saves
the ones
a lot of time.
it pertains to you.
Right.
It's frictionless.
Frictionless?
There's no friction in your part.
Yeah, we even put some WD-40 on there, so it even makes it less.
You need on your knee sometimes.
I had a patient. I'm not kidding. He would take WD-40. He was an older guy. He would spray it on his knee and rub it in. He swore that helped his arthritis.
Well, in his mind it helped, so it helped.
Yeah, the placebo effect at its best. Anyways, he was a nice guy.
Thanks for watching.